Okay, so this is my first um, video recording for my support groups, and this week. I went to AA at St. John's Church downtown Des Moines, and I really enjoyed it. Actually, it um, was an environment that was super welcoming, and I don't know. I was very surprised with the attendance was very high, and so we went. During lunchtime, so I think a lot of people who work downtown were coming and attending. Um, there was a lot of males, and a lot of them were actually older, and also there were some females, but not as many. Um, so my thoughts prior to going to the support group, I've actually been to AA before. One of my best friends from college is a recovering alcoholic, and so I have attended a group with her one time before, so I wasn't necessarily surprised, but I really enjoyed how welcoming they were, and we just said how we were nursing students, we were here to learn from them, and a lot of people ended up like coming and talking to me after, and a lot of them like reassured me that nurses see a lot of alcoholics in the hospital, and they deal with the withdrawals and all the symptoms with that. So that kind of connects with the material and how to assess for alcohol withdrawal, especially in the hospital. But I don't know if my beliefs were necessarily challenged because I have been before, but they were reassured by how honest a lot of the attendees were. They were sharing like, super vulnerable things about themselves, and it was really nice how everybody was, well, they were unsurprised by what they were saying and really supportive. And a lot of people, as they went around in the group, would comment back on other people's stories or their experience and kind of reassure them or congratulate them on their accomplishments. One of the coolest things that there was in the one that I attended was they give out the chips for sobriety, and some guy got his 30-year sobriety chip during our meeting, so that was super cool. And he just talked about how proud he was of himself, and I think that a lot of people expressed after the fact that he was a huge inspiration for them, because there was a few clients that were not sober, or they have like just started their journey. One client specifically that I wanted to talk about was this lady who it was her first time at AA, and I think she had just kind of said that this was like her first step in admitting that she was an alcoholic, and so it was interesting to hear her story and how she, like last week, one of her friends like said something about it, and she had come to the realization earlier in the week, and then she was connected with another woman who attends AA regularly, and so they had gone together, and she had just expressed her struggle with alcohol and how basically her entire schedule revolves around her next drink, and how her family is super impacted by her decisions and her neglect of her family. And so she had shared very early in the meeting, and so a lot of people encouraged her as they went around and said, like the first step is like accepting that you're an alcoholic or admitting to your problem. And so I was very encouraged by that, and just seeing how they support each other. And I think in class we talked a lot about how mental illness is not, there's not always like a straightforward way to treat it, but I think that a lot of the themes around treatment is around like building a community and being around people who maybe have the same struggle like similar to the milieu, like how patients are encouraged to come and interact with others instead of staying in their room and isolating themselves and participate in groups. And so I think this was very similar to groups that I've seen in the clinical setting of just sharing and kind of laying each other's burdens and relating and connecting on that all these people, whether they are sober or they're just starting their journey to recovery, they all have something in common. And so the girl that had just kind of realized that she's an alcoholic can like look up to this other guy who just got his 30-year chip, and they're like in the same boat. And so I was encouraged by that. And moving forward with nursing, I think that nurses obviously encounter people who are alcoholics and people who stay for extended amounts of time in the hospital. They'll go through withdrawals, and so just having empathy and like understanding that they kind of talk about how it's a disease and how it really is a challenge. And so just empathizing with those people. And I've like seen one of my best friends, I've seen firsthand like her withdrawals when I was in college, and just how agitated she got and how it was such a struggle for her. And so taking those experiences and having empathy and trying to help a patient the best way that you can, and that is like the most applicable thing as far as nursing goes. So yeah, I'm excited moving forward to attend another support group, and overall it was very enjoyable and very encouraging. So thank you.